Welcome to The Explainer. Today, we're going to take a tour of one of the most complex and honestly most vital systems in your entire body, your digestive tract. I mean, have you ever really wondered what heartburn actually is, or why certain foods just seem to totally wreck your stomach? So many of us deal with digestive discomfort, but what's really going on in there? Well, we're about to break it all down. To make sense of it all, I want you to picture your gut as this long, winding road. We're talking a 30-foot highway. And we're going to take a tour, stopping at some of the key spots where things can, well, go a little wrong. Okay, so our journey starts right at the top in the esophagus. And our first stop is a super common problem that has, a surprisingly mechanical cause. This is GERD, or gastroesophageal reflux disease. And really, it all comes down to a faulty valve. Think of it like this. There's a little one-way gate between your esophagus and your stomach. But with GERD, that gate just doesn't close up tight. So what happens? All that harsh stomach acid flows backward, it refluxes, and that's what gives you that awful burning feeling we call heartburn. Now this is where it gets really interesting. What are the clues? Besides the obvious heartburn, the biggest giveaway is all about your body's position. The symptoms get way worse when you bend over or lie down. And why is that? Well, gravity isn't helping you anymore. It can't keep that stomach acid where it belongs. It's such a simple physical clue that points directly to a mechanical problem with that little valve. But here's the good news. GERD is usually something we can manage with a pretty clear step-by-step approach. Step 1, it all starts with lifestyle changes, avoiding those trigger foods like spicy stuff and coffee. If that doesn't do the trick, step 2 is medication to get that acid under control. And then for really tough cases, step 3 involves procedures to finally go in and fix that faulty valve for good. Okay, let's keep moving down our highway. Next stop, the small intestine. And this is where things get a little different, because we're going to look at a condition where your body's own defense system is actually the problem. This is celiac disease. And I want to be super clear. This is not an allergy, and it's not just an intolerance. It's a full-on autoimmune disorder. What that means is, when someone with celiac eats gluten, their immune system gets confused and launches an attack on the lining of its own small intestine. And that attack causes real damage, making it hard to absorb nutrients from food. And that's exactly why celiac disease is so much more than just a stomach ache. I mean, think about it. If your gut is damaged and can't absorb key nutrients, the problems can pop up in places that seem totally unrelated. Things like unexplained anemia because you're not getting enough iron, or fragile bones from lack of calcium, even infertility. Sometimes those are the only clues you get. So what's the fix? Well, this slide says it all, perfectly. For celiac disease, the medicine isn't some pill, it's the food you don't eat. A strict, lifelong gluten-free diet is the only way to stop that autoimmune attack and allow the gut to finally heal. All right, we're heading to our final destination on this highway, the colon. And here, we find something we could call the fire down below, a group of conditions we know as inflammatory bowel disease. The two big ones here are Crohn's disease and ulcerative colitis. Now, they both cause chronic inflammation, but this chart shows how they're actually really different. Ulcerative colitis is continuous and pretty superficial. It only hits that inner lining. But Crohn's? Well, Crohn's can pop up in patches anywhere along the digestive highway, and the damage goes deep. They call it transmural, which is just a fancy way of saying it can go through the entire intestinal wall. So even though they're different, the treatment strategy has a shared mission: taming that inflammation. The whole goal is to calm that fire inside, using a range of medications that get the immune response under control. This allows the gut lining to heal and, get back to doing its job. So with all these complex things going on, from faulty valves to autoimmune attacks, you've got to be wondering, how do doctors actually figure out what's happening inside you? Well, they've got this incredible detectives toolkit. To literally see what's going on inside, they can use an endoscopy with a tiny camera. To check for deeper issues, they'll use powerful imaging like CT scans or MRIs. And for really specific problems, there are even tests like manometry that can measure muscle pressure. These are the tools that solve the mysteries of the gut. So, after this quick trip down our digestive highway, what's the one big thing you should take away from all of this? It's this: your gut is communicating with you every single day. Symptoms like heartburn, bloating, pain, or changes in your bathroom habits, they are not random annoyances. They are valuable signals, little data points about your internal health. And that brings us to the most important question of all. Are you listening? Understanding these signals and talking to a doctor about them is the crucial first step toward better digestive health. Because as we've seen, your gut has a lot to tell you.